Because of the tremendous pressure we put on it, the knee is one of the most fragile areas of the human body. Among the most common injuries that can affect it are those that involve a tear in the meniscus, a small C-shaped piece of cartilage that acts as a cushion, absorbing the forces that the knee withstands during walking, running, or many other activities. The meniscus can tear when the knee rotates awkwardly while bearing weight. At Lakecore Medical Center, a full-service clinic that features an extensive orthopedic surgery service, the damaged meniscus can be repaired in several ways, usually using minimally invasive arthroscopy. In a moment, I'll discuss the procedures in more detail. A meniscal tear, either partial or full, is one of the most commonly suffered knee injuries. Typical signs of the injury include a locking of or inability to straighten the knee, or a popping or clicking sound or sensation. In the past, when this important cartilage was damaged, usually as a result of twisting the knee while it is bearing weight, the usual treatment was the surgical removal of the entire meniscus, a fairly extensive procedure. Unfortunately, the long-term effects on the stability of the knee were quite serious. With the advent of arthroscopy, surgery done by inserting a tiny camera and micro-instruments through several small incisions in the knee, meniscal tears have been treated with increasing success. At Lakecore Medical Center, our field-leading arthroscopic surgeons take exactly this approach. The two most common surgical methods to repair the meniscus are the partial meniscectomy and the full meniscal repair. In the partial meniscectomy, the surgeon will remove only the torn part of the meniscus. This option works very well in cases where the tear is relatively minor. Recovery is quick, and the long-term results are usually excellent. A full meniscal repair occurs when significant parts of the outside of the meniscus are torn, too much to be removed in such a way that the meniscus can continue to perform its shock-absorbing function. In this surgery, the doctor will actually suture or tack the torn pieces of cartilage back together. Evaluating which surgery or combination of procedures is required is not always straightforward. The surgeon may have to assess the damage to the knee with the arthroscope itself. Some tears to the center of the meniscus may not heal under any circumstances due to the way that blood flows to the knee. In these cases, the torn part of the cartilage must be removed. Meniscal repair is generally a successful operation, though in some cases the repaired cartilage may not hold and follow-up surgery is required. The length of the procedure depends partially upon the extent and location of the injury, but usually takes between 1 and 2 hours. The surgery is performed either under local or general anesthetic. Afterwards, you will recover in one of Lakecore's exceptionally comfortable private rooms before being released to return home for rest and rehabilitation. Again, depending upon the extent of the surgery, you may need a few days before your knee can bear any weight. You will be able to begin physical therapy quite soon afterward, working towards regaining your full range of motion and rebuilding the strength of the muscles that surround the knee. Lakecore Medical Center also has a complete physiotherapy and aquatic rehabilitation clinic to help you regain the full use of your knee. Some cases of damage to the meniscus can be treated non-surgically, either through exercise, anti-inflammatory medication, or injections of cortisone. If these treatments have proved insufficient and you need knee surgery, Lakecore Medical offers you the highest degree of professionalism and experience. You'll not only have access to the most accomplished surgeons, but to a whole team dedicated to getting you back on your feet as quickly as possible. If you believe or have been advised that you need meniscal repair, call Lakecore Medical today and make rapid arrangements for a consultation appointment.